I'm Sunil Amrith, Chair of the South Asian Studies Council and Professor of History.
Hi, I'm Kavita Sivramakrishnan. I'm a historian of public health and science with a focus on South Asia.
Work by historians on how South Asian societies have coped with past pandemics, many of which were far more lethal than Covid-19, can help us understand some of the social and cultural institutions with which South Asia now confronts the crisis.
And I focus particularly on three epidemics and pandemics. One that is colonial, that is the plague pandemic that occurred at the beginning of the 20th century. The second, which is really a post-colonial pandemic, which is the influenza pandemic of 1957-58. And then I also focus on an epidemic of plague that occurred in the West Indian town of Surat in 1994.
I am Charity Troyer-Moore, and I am the Director for South Asia Economics Research at the Macmillan Center at Yale University. In surveys we conducted in April and May, we asked migrants about their food insecurity, and nearly 1 in 2, so 50% essentially of the migrants that we surveyed, said that either they'd eaten less than normal in the past week or even gone a full day without eating. That was a bit surprising to us, but unfortunately, as we've continued to survey migrants as time has gone on, we've seen that number actually increase, and it's crept up now to something like 63% in the most recent survey that we conducted with migrants, on a very large scale.
The moments of crisis and tension are also those when these kinds of contacts between policies and programs really break down.
The work by economists on how deeply inequality is both shaping and is being shaped by the pandemic, I think, is vital.
So one thing we've definitely seen from these surveys is that some migrants are faring better than others, and some of the vulnerabilities that they're experiencing are very much correlated with historic disadvantage, like being part of a scheduled caste, and in some cases being a woman. These migrants are doing worse overall.